nurse. I work at the office of Dr. Ben Hugo in Virginia Beach, Virginia. And today I'm going to be demonstrating the vein wave technique. It is used for eliminating those pesky little pink veins that we all get usually around our nostrils or across our nose, our cheeks, or our chin. And you might say, well, who is a good candidate for vein wave? Really, the wonder of this is that it's pretty much good for anybody. We do not treat people with a history of epilepsy. We wouldn't treat people with bad cardiac problems or a pacemaker, and we certainly would not treat anyone with an internal automated defibrillator. But that leaves a whole lot of people that vein wave is good for. So vein wave can also be used for little spider veins in the legs, very superficial pink spider veins, and also for the little red dots that sometimes appear on a lady's body, sometimes later in life. The little cherry hemangiomas, I can just zap and boom, they are gone. It's great. So you might say, well, what is vein wave? Vein wave is using high frequency energy transmitted through a little wire onto the vessel, and it coagulates the vessel through a process called thermocoagulation, and therefore the vessel is shut down and disappears. So it's really a good procedure. I will get my gear on now. Enough technical stuff into the procedure. This is my special headlamp. It is a polarizing light that allows me to see the vessels. It just pops the vessels right up, and I can see them waving, getting ready to be zapped. Here we go. All right. It's harder to get on than it is to use. This is Diane, our model for today. She has previously had the right side of her nose done, and today we're going to be treating the left side of her nose. Oh, there they are, just waving. All right, we're going to wipe her nose a little bit with an alcohol swab. We like people to come without makeup on their faces and not having used self-tanning products for about 2 weeks ahead of time. Now this light allows me to see a lot more than what can be seen with the naked eye, which is great because then I can treat everything before they get larger and become a problem. Now Diane is likely to feel just a little bit of a zap when I apply the energy, the little pulse. And I don't know if you can see that wire, it's very teeny tiny thin. And normally we do the vein wave procedure in time increments of 15 minutes. In 15 minutes, I can zap a lot. Great. Okay, let me get my foot pedal. Okay, so Diane, are you ready? I'm ready. Great. Okay. Here we come. First little. How's that feel?
Fine.
Not bad? Okay,
No, not
that's
bad.
good. Now normally, depending on the size of the vessel, it's not uncomfortable, It does, however, feel a little bit stingy around the nostrils when we work down there. I have to admit that. But it's not anything that people can't tolerate. Now I'm applying the pulses 2 or 3 millimeters apart, and when it's done correctly, I can just see the vessel close down. Zap, it's gone right now, which is very gratifying. I tell you, once I get this headlight on, I could go forever. I could really get carried away at this. All right, how's that feeling?
Fine.
Okay, now you might be able to see that there is some generalized redness developing. Usually the treated area does get sort of pink for several hours, and then over the course of 2 or 3 days you might see some crusting along the vessels that were treated, or some red, faint red lines, like a little cat scratch appearance we call it, but that usually disappears over anywhere from 5 days to 2 weeks, depending on how aggressive we have to be. And we do like our patients to avoid sun very carefully afterwards, using sunscreen. Oh, good. Here's a little red spot I was talking about on her cheek. So I'm going to go after that. There we go. Gone. There's another one gone. Now I'm going to do right below your nose here, Diane. People often get the urge to sneeze.
Yes.
Are you going to sneeze?
I don't think so.
All right. Alrighty. So, fast forward. We have magically been doing this for 15 minutes now, and we're finished on Diane. Take off the headgear. And so, as you may be able to see in the video, she does have some generalized redness. I did some of those little red spots down on her chest and took care of those little cherry hemangiomas down here. I did a little bit on her chin and most of the vessels on this side of her nose, and some down here in the nostril where it was a little bit tender, but not bad. So now I'm just going to apply a little hydrocortisone cream. Sort of calms down the reaction and probably feels good. And she is going to remember to use sunscreen every day and reapply if she's out in the sun. But generally she will be able to apply makeup in several hours and resume her normal activities. And that is the vein wave procedure. So if you would be interested in having some of your pesky pink vessels removed, give Dr. Hugo's office a call at 757-496-4801, and I will be happy to zap it to you.